Good morning, Emily. My name is Christine. Thank you for agreeing to be my patient today.
You're welcome, Christine.
May I please complete this exam for my NUR607 class and use you as the patient today?
Sure, yeah.
Okay, thank you very much. We're going to inspect all the different systems in your body in order, and I'm going to begin with the head, eyes, ears, nose, and throat.
Okay.
Could I ask you to please close your eyes and open those? Thank you. Next, I'm going to palpate and auscultate the temporal arteries, and I'm checking for thrills or bruits, and I will do the same for the carotid arteries one at a time. Palpate and auscultate. Thank you. Next, I'm going to feel your jaw, your TMJ. Could you open your mouth for me, please? And close it. And I'm checking for any clicking or crepitus or anything of that sort that may be there. From here, I'm going to feel the lymph nodes, first in the occiput, and then in the clavicle, noting that if you were really a patient of mine, I would do this right on the bare skin to check for lumps, bumps, or any kind of swelling. Then the axillary node, again checking for any palpable nodes, asking the patient, have you had any exposure to unusual illnesses or anything of that sort recently?
No.
After the nodes, I'm going to inspect the scalp and the hair. Have you noticed anything unusual, any itchy patches or sore places when you've shampooed or brushed your hair recently?
No.
Okay. Then I will inspect your neck, looking for symmetry or lumps or bumps. May I ask you please to face the head of the bed? Thank you. I'll check the thyroid from behind, checking for any areas of swelling or any signs of an enlarged thyroid gland. Thank you very much. Next, I'll move to the eyes, and I'll ask you to close your eyes, and I'm going to just feel your eyelids, and I'm going to look at the eyes. You can open them. I'm going to look at the bottom lids and the upper lids. Thank you. Then I will take my ophthalmoscope and I'll ask you to cover your left eye, please. And what I'm going to do is use my ophthalmoscope and check the optic disc and the retina. Thank you. And you can cover the other eye, please. And again, checking the optic disc and the retina. Great. Thank you very much. Next, I will use my pen light to check your pupil dilation and constriction. So I'll put my light on, and then I will check for brisk pupillary constriction on both sides. Excellent, thank you. Now I will ask you to please keep your head facing me and follow my finger with your eyes only. And I'm checking your extraocular movements here. Very good. Great. Thank you. To check convergence, I will ask you to watch this pen tip, and as I move it toward your nose, I'm checking to make sure that the eyes move symmetrically, because if they don't, that's a sign of hyperthyroidism. From here, I'm going to check your ears. I'll look at the outsides of your ears. Have you had any ear pain? Do you feel that you're experiencing any hearing loss, anything of that sort? No. My otoscope, I will use pulling the auricle up and back to look into the ear and inspect the ear canal, the eardrum, on both sides. Auricle up and back, and inspection of the ears. Next, I would like to ask you to stick your tongue out straight, and then move your tongue to the right side, the left side, and then put it up on the roof of your mouth. Great. With my tuning fork, I'm going to test your hearing and the conduction of your hearing. The first thing I'll do is put my tuning fork on the top of your head and ask you to tell me where you hear that vibration.
I hear it in both my ears.
Great. Next, I will ask to test bone conduction for you to let me know when you stop hearing the vibration.
It stopped. It stopped.
Great. And I'll do the same on this side.
It stopped. It stopped.
Great. Thank you. Now I will be completing my head, eye, ear, nose, and throat exam with palpating your sinuses, the frontal sinuses, and the maxillary sinuses. Do you have any pain in your sinuses?
No.
Okay, great. Wonderful. Now we'll move on to the Oh, do you wear glasses?
No.
You don't. If you did wear glasses, I would have you stand, even if you don't, I would do the Snellen chart. I would have you stand 20 feet back, and I would ask you to read the eye chart across the room to test your vision with and without your glasses to see if it was 20/20. Now I'd like to move on to the cardiovascular assessment. Okay, I'll ask you to please lay down at this 30-degree angle. Thank you. The first thing I would like to do with the cardiovascular assessment is test for jugular vein distension. And the way I will do that is, if you could turn your head toward the lamp for me, and I'm going to find the jugular vein, and I'm going to use this index card as a way to locate the vein and place a measure of it using this measuring tape in the mid-sternal region. From here I can see that we have less than a centimeter of measured distance, and if I add 5 centimeters to that, that's only 6 centimeters. So that shows there's no jugular vein distension because it's less than 8 centimeters. Now I'd like to assess your heart. To begin, if you could please lay on your left lateral side. And I'm going to listen. I'm going to feel for the primary pulse at the apex of the heart. And again, if you were my patient, I would have you wearing a Johnny, and I would do this and watch too. Could I ask you to please lay back on your back? And now I will palpate pulses first in the brachial area. Good. The radial pulses. Good. Excellent. The femoral pulses. Excellent. popliteal, posterior tibial, excellent, and dorsalis pedis. Great. Now I will listen to your heart sounds. First, I'll begin using the diaphragm of my stethoscope. I will be listening to 3 locations on the left intercostal region and 2 on the right. Then I will switch to the bell and listen to the same 5 locations. I'm listening for S1 and S2. Then I will listen to the pulmonic on the 2nd left intercostal space, the herb on the 3rd left intercostal space, the mitral valve at the 5th left intercostal space. Tricuspid valve will be at the 4th right intercostal space. Aortic will be at the 2nd right intercostal space. Then I will move to the bell of the stethoscope to listen for any abnormal heart sounds. Second intercostal space. 3rd intercostal is herb. 5th intercostal, mitral valve. 4th right intercostal, tricuspid valve. 2nd right intercostal, aortic valve. Switching to the bell. Switching back to the diaphragm, I'm going to listen to the renal arteries, iliac arteries, femoral arteries, and aorta. And if I hear the swishing of blood, it might be indicative of an aneurysm. Great. Now I'll ask you to turn onto your left side one more time. And using the diaphragm of my stethoscope, I'm going to listen to the apex of your heart. Thank you. I wanted to listen for 1 full minute to assure that I was counting a full apical pulse. Also, at this point, I would do your blood pressure just to make certain that the pressures are within normal limits. And that would be the conclusion of the cardiac exam. Could I ask you to please sit at the side of the bed and we'll start the respiratory exam. The respiratory exam is designed to assess the lungs and the thorax and assure that you don't have any illnesses or infections and that your respiratory system is healthy and strong. If you were really my patient, I would be assessing your thorax visually without a shirt on for heaves. I would also be inspecting your integument to make sure you had no rashes or lesions. So we'll start with, could I ask you to turn toward the head of the bed? First, I'm going to start by determining whether or not, or assessing fremitus. Fremitus is best assessed with the ball of the hand, and I'm going to ask you to say 1, 1, 1 repeatedly.
1, 1, 1.
And again.
1, 1, 1.
And again.
1, 1, 1.
And one more time.
1, 1, 1.
Now, while my hands are here, I will ask you to take a very big deep breath and exhale. And here I'm checking for symmetric chest expansion. Thank you. And now you can face me. When I listen to your lung sounds, I'll do that in both the front and in the back. The first thing I'll be listening for, I'll just be listening for asking you to take deep breaths in 6 locations in the front. And then I'll ask you to take deep breaths 6 locations in the back. Then I will ask you to say 99 repeatedly in the same 6 locations and in the same 10 locations in the back. Okay? Mm-hmm. All right, let's start with the front. Deep breath, please. And out. And again. And out. Good. And again. And out. And again. Great. Now I'll have you say 99.
99.
And again.
99.
And again.
99.
Okay.
99. 99. 99.
Great. Deep breath in. And out. And again. And out. In. And out. And in. And out. In. And out. In. And out. And in. And out. And again. Okay. In. And out. And in. And out. Now I'll have you say 99.
99.
And again.
99. 99. 99. 99. 99. 99. 99. 99. 99.
Great. Thank you very much. That concludes our capillary refill. Almost forgot the capillary refill. I'm testing capillary refill as a part of the respiratory, and it's really cardiovascular. Okay, and your toes. Great. Excellent. Okay. That's the end of the respiratory. Now we'll do the abdominal GI. I'll have you put your head down on the pillow, and then I'll take a second pillow and place it under your knees. The important thing is that you're comfortable on the table, and I'll test to make certain that your back is down on the table. Standing on your right, I would initially begin by looking at the skin and inspecting the abdomen. I would properly drape you to make certain that really just the abdomen is exposed. And then I would look first, inspecting the area. After I inspect, I would auscultate the area, starting with the right lower quadrant. I'm going to listen for a couple of minutes to distinguish the vowel sounds that I'm hearing or any other sounds that I'm hearing in each of the 4 quadrants. hearing active bowel sounds, I will move from auscultation to percussion. I'm going to percuss in each of the 4 quadrants 3 different times using a zigzag pattern. And I'm listening for tympanic and dull. I would expect that I would hear tympanic over the peritoneal cavity, and I would hear dull up by the liver. I want to make certain that that I'm not hearing dull too far below, because it might mean that the liver's enlarged. And I would also be percussing the spleen, expecting to hear dull but not below the lower rib. After I've percussed the 4 quadrants and the liver and the spleen, at that point I would begin light palpation. The purpose of light palpation is simply to determine if there are any areas that are tender, uncomfortable, any lumps, bumps, abnormalities that might manifest themselves and be clear. I won't do deep palpation today, but if I were to do deep palpation, I would wrap my hand under the right side, go up underneath on the right side of the flank. If I could feel the bottom of the right kidney, it might indicate an enlarged kidney. I would wrap my fingers around the lower edges of the liver to palpate the liver margins on the right to determine whether or not the liver was enlarged or inflamed. And then on the left mid-axillary area, I would wrap my hands up under the rib cage, and I should not be able to feel the spleen unless it is enlarged. That's the abdominal exam. Okay, let's move on from the abdominal exam to the musculoskeletal exam. May I ask you to sit up? The musculoskeletal exam will determine if you have any abnormalities of any of your joints, any weakness, strength deficits, if your range of motion in all of your joints is within normal limits. So we'll start with your neck, and I'm going to look at it first. Then I'm going to ask you to drop your head forward and then back. Good. And then side to side. Then put your ear on your shoulder, ear on your shoulder. To test the strength of your neck, I'm going to ask you to push against my hands. And again. And again. And again. Great. We'll move on to the shoulders. Could I ask you to stand, please? Testing the shoulder flexion and extension, I'll have you move your arm over your head in a 180 degree angle. Great. And the other side. Great. And then testing shoulder extension, I'm going to ask you to put your hands behind you one at a time. Great. Could you turn your back to me? Testing shoulder adduction and abduction. First, to put your shoulder up, your arm up like this behind you, and then across the front of you. Great. And then the same on the other side, and in front of you. Super. You can sit back down, please. To test the strength of your shoulders, I'm going to ask you to shrug. Great. Thank you. Now your arms. Good. If you could put both of your arms out straight and then palms down and then turn and put your palms up. Good. Bend both elbows. Super. Moving on to the elbows, I'll have you flex your arm, extend your arm. Now pull against my hand. Great. And now push against my hand. Great. And I'll have you flex and extend. Pull against my hand. push against my hand. Great. Now we'll take a look at the wrists. Wrist down. I'll have you flex your hands up toward me. Great. And then down to the floor. Good. And then your hands out like this, and then in like that. Great. Now to test the strength of your wrists, I'm going to ask you to push your hand against mine. Great. And push it against mine. Good. Other side. Push. Good. And push. Super. Spread your fingers apart for me. And try and keep them apart. Good. And the other side. Excellent. Now we'll work with the hips. If I could ask you to stand and face me. We'll begin with hip flexion. Put your foot in front of you, and then extension behind. The other side, flex and extend. Great. Adduction and abduction, abduction and adduction. Good. Now I'll have you lay down to test the strength of the hip. If you could try and push against my hands. Good. And the other side. Good. Good job. Whew. Now we're going to go to the knees. We'll test flexion and extension. And then I'm going to have you push against my hand. Yep, great. And the others. And oh yeah. Great. Now knee flexion and extension. Push against my hand. Okay, and push against my hand. Great. Ankles. Ankle flexion. Now point your toes. Great. Now I want you to push against my hand. And then push against my hand. Push against my hand. And push against my hand. Great. Can you side to side? Can you wiggle your toes? Curl them? Great. Okay, that concludes our musculoskeletal exam. If I could ask you to sit up one more time, because I'm realizing that in the respiratory exam I've neglected to percuss the respiratory region.
Okay.
So I'm going to go back to that now. If I could ask you to face that wall, and I will be percussing over the lung fields. Thank you very much. I also would like to add that before I began the exam, I washed my hands in the other room on my way into the room.
Okay.
Thank you. Next, after musculoskeletal, we're going to move to neurologic. If I could ask you to lay back down here, we'll do the neurologic exam. Utilizing my reflex hammer, I'm going to begin with the brachial reflex. Then I will look at the patellar reflex. Actually, I'll have you sit up for the patellar reflex. Thank you. Good. And then the Achilles reflex. Great. Now I'll move to cranial nerve 5. If you could close your eyes for me and open them, clench your teeth, and move your jaw from side to side. And I'm checking for symmetry or asymmetry. Cranial nerve 7, I'm going to ask you to tightly close your eyes and frown, open them, and then smile. Do you have any pain, discomfort when you do that?
No.
Okay. Now I'll ask you to stick your tongue out and say, thank you. And I would like to do the corneal, soft corneal test. Now I'm going to test for soft and sharp, and I would like to ask you to close your eyes. And when I touch this to your face, please tell me if it is soft or sharp.
Soft. Sharp. Soft. Sharp.
Excellent. Now I'll ask you to lie back down. I'm gonna have to stop it. I have to stop the recording. Excellent. Megan, I'm gonna ask you to sit up, please. Emily? First, next I'm gonna test your peripheral vision. If you could cover your right eye for me and look at me and let me know when you can see my fingers.
I can see them.
Great.
I can see them.
Great. And now I'll have you cover your other eye.
I can see them. I can see them.
Great. Now I'm going to do the whisper test to make sure that you don't have any hearing damage. I'm going to say 3 things, and I'd like you to repeat them. If you could cover up your left ear for me.
3, U, 1.
Great. And cover your right ear.
4, 5, 2.
Thank you. Great. Now moving on with the neurologic exam, if you could stand. Sorry, sit. I apologize.
It's okay.
Sit. And run your right heel down your left shin. And then do the reverse. Good. Now if you could stand and walk across the room toward me. And turn. Now I'll have you walk in a heel-toe fashion. Great. Now if you could walk back toward me on your toes. Okay, and turn and walk on your heels. Great. Now you can take a seat. And actually I can have you lie back down here because I'm going to finish up the neurologic exam by testing whether or not you feel sharp or dull when I touch your arms and legs, okay? So if you could close your eyes for me and let me know, is this sharp or dull?
Dull. Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. Sharp.
Great. Now, when I hold your big toe with your eyes closed, I want you to tell me if I'm bending your toe up or down. Ready?
Up. Down.
Great. Now I'm going to put a common item in your hand, and with your eyes closed, I'd like you to tell me what that item is.
A coin.
Yes, thank you.
Penny, maybe? Yeah.
A very definitive way of checking that is to ask you to tell me which is heads and which is tails with your eyes closed. Next, I'm going to have you close your eyes and I'm going to draw a number on your hand, and I'd like you to tell me what number that is.
3.
Thank you. That concludes the neurologic exam. Now I'll ask you to sit up and we'll finish up using the tools for the psych exam. Could you please tell me your name?
Emily Gorman.
And where are you, Emily?
My house.
And
or a doctor's office.
And what day is this?
Sunday.
And what time is it?
It's like 8:30 in the morning.
Excellent. Now I'm going to ask you to count backwards for 1 minute from 100 by sevens. And I'm going to time you. Okay, you may begin.
100, 93, 86, 79, 72, 65, 58, 51, 44, 37, 30, 23, 16, 9, 2.
Thank you very much. Now I'm going to test your short-term memory. I'll give you 4 words, and if you could please repeat them after me.
Mm-hmm.
Box, flower, apple, card.
Box, flower, apple, card.
Now, if you could count backwards from 20 to 0.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
And now repeat the 4 words.
Box, apple, flower, card.
Thank you. To test your longer term memory, I will ask you, what did you do to celebrate your last birthday?
I had a birthday party.
Okay. There's something else. Thank you very much. Oh, I have a piece of paper here. I wanted to test your comprehension. So I'm going to hand you the piece of paper, and I want you to do exactly as it says on the paper.
Okay.
There it is. Thank you. Thank you very much for your help today, Emily. I really appreciate it.
You're welcome.